Hello, Travis. How are you today?
I am well. How are you doing?
I'm doing all right. Thank you for coming out to My City, My Health. How's it been going for you so far?
It's been great so far.
So far.
We've had a great time. It's been a great turnout. We've really appreciated getting to make new connections and spend some time.
Cool. So tell us a little bit. I see you're with WellPoint. Tell us a little
Yes.
bit about WellPoint and the services you offer.
So WellPoint's one of the Medicaid MCOs here in Iowa, a managed care organization. So when a person applies for Iowa Medicaid, the state determines whether or not they qualify, and then once they do, they're then put with one of the Medicaid MCOs. They have the opportunity to work with one of the three different offered MCOs here in Iowa. So as an MCO, we do a lot of the work between providing communication and information, as well as services between the provider, the patient, and the state itself. So a lot of the middle work between all of those different entities. And so we like to provide a lot of different benefits, a lot of different programs that help support community health.
Okay. And from a standpoint of, you said support community health, how do you go out outside of being at events like this, right? How else do you show up in the community?
Absolutely. So one of the things we're most proud of is our CHAMP program. Our CHAMP Housing Assistance Program is a referral-based program where people can have assistance with basically just making sure they're able to keep their housing underneath them. We all go through different points in life where we need a little bit of extra help. And we recognize as a company that people are not as concerned with their health when they're more concerned about where they're going to sleep that evening. So it's very important to make sure people are able to stay in housing that they can afford. So we have these programs that assist with that. We also do different kinds of benefits that assist with maternal resources. We do provide some benefits for members who are pregnant or nursing up to 60 days postpartum to be able to receive a gift card that they can utilize for things like a stroller or a pack and play or those different things. So that's $100 that they can use for that. So there's different resources we try to recognize. There's different kinds of populations even within Medicaid that need different kinds of help.
Okay. Are there any services that you would love to highlight, that you would love for people to get a more knowledge of or understanding of today?
Sure. So the CHAMP program is the one that I would probably highlight most. We actually have our director for that program, John McCauley, here today. I'm happy to have him joining us, and I've already had a person stop by and talk about how it positively impact her life.
Oh, wow.
So it was really great to hear that this morning. Other than that, I think that I would just like to highlight the fact that there's a variety of different benefits that we offer. There's usually something that for everybody, even the Healthy Rewards program, for being able to get money back on a card for taking care of important appointments, like even just your health risk assessment or taking care of those first vaccinations for baby, taking care of these different kinds of resources or appointments that are super crucial for just being proactive in your health. We love to thank people for being proactive in their health because it always turns out to be better for everybody.
That's a common theme I'm hearing today. So I talked to Iowa Heart. Yes, we talked to just being proactive, getting those tests done. So being proactive, what would you say the top 3 things that you have seen that you wish people would be more proactive about?
Oh, man. There's a lot of things. I think for one, maybe the most important thing I would highlight is the idea that when it comes to being proactive, I want to circle it back to kind of a holistic approach because, for example, I have a vehicle that I drove here to get here today. If I'm only going to take care of the things in that vehicle after it breaks down, it's not going to do an awful lot for me if I'm treating it after the fact. So going in for your annual checkup, going in and establishing your doctor or your primary care provider and having a conversation with them, having that direct interaction with your doctor and understanding, hey, what's going on with my blood pressure? What's going on with my cholesterol? What's going on with these different factors? Because a doctor is going to help you get a bigger look at the big picture rather than just the numbers. It's so easy in life for us to fixate on trying to get numbers to go a certain direction, whether it's the scale or it's my A1C or whatever it is, but it's really about the whole picture. And so when you start those conversations with your PCP, you start to actually build that relationship and say, okay, what could I do differently? Could I go for a walk today for 20 minutes? That would make a huge impact on my health. Bigger picture. So I would love to narrow it down to just 3 different things, but the reality is I think building a relationship with a doctor you trust or a primary care provider you trust, or for your kids or for your family, that's the most crucial thing I could highlight for people because we open up to people when we have that good relationship.
That is true. How long have you been with WellPoint?
I have been with WellPoint for 3.5 years.
Okay. Okay.
Yeah. So not that long, but long enough to have seen a lot of interesting changes.
Very knowledgeable for 3.5 years on what you've experienced so far.
I appreciate that compliment. I feel like I could be in Medicaid or the Medicaid space for probably a decade and still not know half of what I really would love to know.
I'm sure.
There's always more to be learning, that's for certain.
That's for sure. Well, how can people find out more, stay in contact, get connected with WellPoint?
One of the best ways to reach out, for one, if you're here today at the conference, stop by at my table. We have our member services number as well. That's available on some of our flyers as well. You can check out the WellPoint website for Iowa WellPoint. Another great way would be, there's a good chance that your doctor would have information, and a big part of my role is to make sure that those flyers are out there in the community. Gotcha. So if you see me at community events, or if you look over in your doctor's office and see some of those flyers or information pamphlets there, I'm trying to make sure that those are provided as well. But going online, or we also have a mobile app called the Sydney Health app, SYDNEY. Okay. So you log into it just like you would any other app. You can actually connect your Medicaid information, your Medicaid card, and with that app, and that app can actually contain your card as well. Because I don't know about you, but I sometimes misplace things, or I've left the house without my wallet before.
Yes.
This isn't going to be like public, right? I've never driven without my license at any point in my life. But having those cards or information present when you've had a stressful, hectic day, especially if you've got kiddos, and it took everything you could just to corral everybody and get them to the doctor's office, that Sydney Health app is super helpful. Plus the telehealth options and other things and resources that are in that app.
So telehealth, before we end, just want to bring this up really quick, because I don't believe people really know about telehealth and how important it is, or a great resource it is. I think people might have been aware of it during COVID because you couldn't get into spaces.
Absolutely.
But telehealth has actually helped me quite a bit.
Excellent. So I was going to say, if you want to share on that, be my guest. But otherwise, I could highlight a little bit from my own personal experience.
Yes, let's do that.
So this summer, I had the privilege to actually do a little bit of expanding education. I actually took my EMT certification this summer. Just to kind of.
Did you get the certification?
I did get my certification.
Congratulations.
It was an effort, but I certainly got there. So I'm a nationally registered EMT. I'm just an inexperienced one at this point in time until I have more part-time experience. But where I'm going with it is this. I had an opportunity to spend a lot of time in emergency rooms this summer as part of my education with that EMT program. And I got to see firsthand how many people come to the emergency room and unfortunately have to sit and wait for a little while. And the reality is that emergency rooms have a lot that they need to do for triaging the level of pain and the conditions of patients. So what you and I might consider to be a number one issue might not actually be a number one issue in an emergency room. That's why I highlight telehealth, is because you can have that conversation with a doctor at 3 a.m. or 4 a.m. and avoid sitting in the emergency room for a longer time, which is less stress on your medical system and less stress on yourself. And you can get that information, maybe get that diagnosis or get a prescription in the order without even leaving your bedroom, really. You could just, maybe run a comb through the hair, something like that, but if you want to. But the other thing as well is it's a lot of effort, as I touched on earlier, to sometimes get kiddos with you. You might not have childcare. It's my understanding kids don't always get sick at the most convenient times possible. So having that conversation early in the, or having that conversation when you can't necessarily get a sitter to cover for you or to watch the kiddos instead of having to leave your home, just another convenient way to be able to get that help that you need.
That's amazing. So y'all heard it here first. Telehealth is really important. It's a great resource. I have used telehealth as well in the past, and it is a great way to get a quick diagnosis, actually, and a way to figure out if should you go to the ER or should you not. Unfortunately, one of mine did tell me you need to go to the ER.
And sometimes we need that objective opinion from an outside perspective. Hey, you really should load up into the car. Okay, well now I know.
Right. Well, Travis, thank you for coming on our Community Resource Podcast and talking about WellPoint. Again, you all heard all the different ways that you can connect with Travis and WellPoint. So go ahead and do that. And I hope you have a wonderful rest of the conference day.
Thank you very much. It's already starting off great.
Thank you.
Thank you.